I think everybody who works in the ambulatory care setting at Princess Margaret Hospital recognizes that we could do better. They all want to do better, and I think what people found frustrating was that they didn't see a way to fix some of the problems that we all saw were occurring in the ambulatory care setting.
We talked to a lot of frontline staff, many of whom mentioned to us that they thought we needed to refresh our approach to ambulatory care.
I think a lot of what was driving the need for changes with the actual patient volumes that continued to go up year after year after year.
There's just an enormous need for us to increase capacity. There are more people being diagnosed with cancer, more people that need treatment.
The patient complaints had continued to escalate and escalate and escalate.
We knew that we were incurring a lot of overtime costs in staff because clinics couldn't finish on time.
Patients would wait sometimes an hour or longer to see us, and none of us were happy about that.
But we just kind of hit a wall and people just said, we can't cope anymore.
When we started out, we wanted to first of all improve the patient experience and to make sure that they were delivered high quality and modern cancer treatments, and that would start in our clinics. Second of all, we wanted to create better interprofessional teams of healthcare workers, doctors, nurses, allied health professionals, that together we would have very strong teams, because that's what it takes to deliver safe and effective patient care. And thirdly, we wanted standardized processes and smooth flow through clinics, and that we'd register patients in the same way and we'd adopt best practices. Every patient would have a treatment plan, and that we'd have standard processes to get patients through clinics that we could look at, implement, evaluate, and know what the standard of care is we're delivering in the clinics overall.
How do you do all that? How do you make sure that you're using these resources as effectively as possible, improving things for patients, having the flow of patients through the clinic work as well as possible? There are just a lot of different complex elements, interactions with laboratory, with imaging, with our physician schedules, our nursing schedules. It's a complex problem trying to organize ambulatory care effectively.
There was 3 of us in the extra program, myself as head of medical oncology, Sarah Downey, who's the VP of the cancer program, and Barbara Fitzgerald, who's the director of nursing. We all invested in the extra program and this project. And I think because we were all together in the extra program, it created a sense of teamwork amongst the 3 of us, and it also created a very strong commitment amongst us who were also very busy and have other commitments to make sure that this project worked.
We had access to phenomenal fellow colleagues and also to the faculty and mentors in the program. And so in many respects it set us up to be more successful.
It allowed our team, our leadership team, to actually plan this together as part of their project. So it gave us an extra stimulus, an extra focus, and gave them the resources that extra brings to bear.
We looked at what happens to a patient as they go through the clinic and the number of interactions they have with different people and the number of handoffs, if you like, from person A to person B.
We needed to define how patients would be referred into the institution. We needed to figure out the best approaches to scheduling patients. We needed to think about who was in clinics on what days to see patients. We needed to think about what nurses would provide care to the patients, who they would call, how they could contact us after hours. So there are a lot of elements we needed to try to weave together to create solid teams.
I think, you know, you can sort of think of this as rebuilding a boat as it's floating across the Atlantic. You know what I mean? It's like you can't stop and just redesign things and then start again. You have to redesign things while you're running the busiest cancer center in Canada, full blast, looking after as many patients as possible.
How do we measure success? How do we know that we're doing better?
I think we saw signs of progress right from the very first steps.
We are certainly seeing less overtime.
And it has dropped phenomenally. And that's because we can actually plan clinics in advance.
We're seeing less sick time, which I think is a reflection of staff satisfaction.
We put in telephone triage lines in all our clinics, and the ability to call into a clinic and have a question answered has been of great value to people.
Oh, okay, well, that's good.
The biggest difference for me, I think, is that when I go into the clinic now, I know all of the nurses and the clerical people. They all know me. We're used to working together. And I think there's also a big sense of a shared experience.
So if we start up there, we have percent on time starts.
It's just a difference in attitude and perspective. It's almost hard to quantify, but it's a great feeling. And I enjoy going to the clinic every day because I know that however busy it is, we're all going to work together and we're going to get it done.
The best part, I think, for the patients is the waiting times. There's definitely decreased, and they're not here so late in the evening into the overtime hours. For sure, that has been a huge improvement for patients.
We do tend to see people on time more often.
A couple of clinics we have measured wait time from the time the patient checks in to the time the patient gets in the room, and the time that patient's in the room to the time the doctor gets into the room to see them or a clinician. And those have dropped dramatically to within 15 minutes in a couple of clinics.
I think the EXTRA program and the Canadian Health Services Research Foundation offer people who are invested in major change projects the advantage of, first of all, peer support from their colleagues across the nation who are also working on change management issues, the responsive faculty who respond to their projects, give advice on their projects, the importance of presenting their projects for the participants in EXTRA gives them a chance to formally present and get feedback. I think it's a very important part of a major change management project like this.